Hi folks, my name's Natalie, Senior Health Science Educator here at the Discovery Center. We had nearly 100 individual questions come in from older adults across Nova Scotia around vaccination against COVID-19. And we found some incredible local experts to help answer those questions. The science around this topic is moving quickly, so please note the date of filming that appears below each expert. Without further ado, I'd like to introduce you to our first expert, Dr. Maureen Carew, who will be answering questions about vaccine safety for older adults. Dr. Carew, would you introduce yourself, please?
Yes, thanks. My name is Maureen Carew. I'm a public health physician and I'm working as a medical officer of health in Nova Scotia. And some of the areas that I'm covering are long-term care. So I'm familiar with vaccination in the long-term care in older adults. And as well, I'm a member of the vaccine expert panel in Nova Scotia. I'm happy to be here today to answer your questions.
Fantastic. Well, we are more than happy to have you join us today. So I'm going to start with the specific questions that older adults had in this area, starting with, are the COVID-19 vaccines safe for older adults?
Yes, so that's a very good question. But yes, there are currently 4 approved vaccines in Canada. But the ones that are being commonly used right now are Pfizer, Moderna, and AstraZeneca. And they are all considered to be safe and effective in preventing COVID-19 in older adults. So receiving a COVID-19 vaccine is a safe way to build protection against the disease because COVID-19 can have very serious, life-threatening complications, especially for adults that are over the age of 60. And there's no way to really know in advance how COVID-19 is going to affect you. So having a COVID-19 vaccination will really help protect you because it teaches your body how to fight the virus without actually having to experience the disease. I'd like to mention that only vaccines that have been deemed to be safe by Health Canada are approved in our country and used in Nova Scotia. And that the process that they use is very rigorous and that the vaccines have to have been tested on humans in clinical trials. They have to meet all the requirements in our country and look with laboratory testing as well. And that we continue to monitor for any adverse effects even after the vaccines are given in Canada. So we're able to pick up any safety signals over the long term.
Right, that monitoring and evaluation piece of the vaccine timeline, very important. Great. So the second question is, will I have side effects from the COVID-19 vaccines? And if so, do older people have more side effects?
Well, vaccines are just like any type of medication. So really, yes, side effects are expected. And they are quite common with the 3 vaccines that we're using in Canada at this time. The most common side effects are pain and redness at the injection site, fever, headache, and sort of a feeling of tiredness and malaise. These effects are usually last for about 24 to 48 hours, and they usually resolve completely on their own. So they're not considered serious. They don't usually need any kind of medical attention. And they are certainly within the realm of what you would see with, other types of vaccines as well. If someone is concerned about having a side effect after their vaccination though, so something that they think may be unusual or persistent, we ask them to see their physician or their healthcare provider. And anything that's unexpected or like a severe side effect would be reported through our adverse events following immunization reporting system. But in general, yeah, the main side effects are just local pain in the arm, maybe a little bit of a headache and feeling kind of tired and maybe unwell for a day or two, but they all resolve spontaneously. For older adults, that's a very interesting question because in fact, older adults tend to have less side effects from COVID vaccine. We're not entirely sure why, but it may be because they have a different type of immune response compared to younger individuals. So it doesn't mean that the vaccine still won't protect you, we know that the vaccines, protect older adults quite well against especially severe effects of the vaccines. It still protects you. It's just with a different type of immune reaction. The rate of having that sort of local pain and local reactions seems to be less.
That's really interesting. That's something that I didn't know. So it's always fun doing this. I always get to learn something as well. Fantastic. It's definitely worth, a little pain and redness to be safe. I'm definitely on board with that. So our next question is, do we know of any long-term side effects from the COVID-19 vaccines?
Well, to date, we're not aware of any long-term effects from these specific vaccines because we've only been using them since approximately December.
Mm-hmm.
But that is something that will be monitored over time in Canada and globally. So the individuals that took place in those clinical trials in order to approve the vaccines, they are going to be monitored over the long term. But what I would say is that, these aren't necessarily new vaccines, that we've actually been studying the mRNA vaccines and the viral vector vaccines for several decades, because we've been looking at them to develop vaccines against other diseases like cancer, even influenza, and even Ebola virus. So we've been working with these types of vaccines for at least a decade or two, and so far have not seen anything long-term. And as well, we don't really expect that they should cause any long-term side effects, mainly because the viral vector vaccines and the mRNA vaccines break down very quickly, like within a couple of weeks, once they're injected into the body. Once they sort of do what they're supposed to do and induce an immune response in your body, they really break down quickly and are just excreted out through your body's normal system. So we expect that they should have a safe long-term profile as well.
Great. Yeah, one of my favorite things to tell people is, we made it in 11 months, but there's 10, 20 years of science behind that enabled us to do that fast. Great.
Yeah, that's exactly right. Yeah.
Yeah. So here's a question from an older adult in Nova Scotia. What if I have a reaction to the first dose of a COVID-19 vaccine, assuming that this person was getting a 2-dose vaccine?
So if you have one of the milder reactions, like I had mentioned, just, the local swelling, headache, a little bit of a fever, you definitely can get your second dose. The main contraindication to getting your second dose would be if you had a severe allergic reaction. So that's a very rare event with these types of vaccines, but it's possible with any vaccine to have what we call an anaphylaxis. So that's a severe reaction that you would have usually within about the first 15 minutes of the vaccine. So if that has happened, then you would have to see your doctor and an allergist before you got the second dose of the vaccine.
Right. Okay. And you correct me if I'm wrong, but you have to be monitored for 15 minutes after you get your COVID-19 vaccine, same as if you were getting the flu shot, correct?
Yes. So with the COVID-19 vaccines, we are monitoring people for 15 minutes afterwards. In some cases, individuals may be told by their physician to stay a little longer if they have a history of, anaphylaxis to maybe something previously, not to this vaccine, but to something in the past. Then they may be instructed to wait a little longer. But the reason is that our healthcare professionals that are administering the vaccine are very well trained in how to manage anaphylaxis and allergic reactions. And they do develop generally within the first 15 minutes. So they are completely reversible with treatment and injection of epinephrine. And our healthcare professionals on site are definitely watching, and including even in the community clinics and pharmacies and physicians' offices, they'll be watching for any signs of that type of reaction. And as I mentioned, it's actually very rare.
Right.
The chances of that happening are extremely small based on what we've been seeing, after immunizing millions of people, across the world. So.
Great. Beautiful. Well, Another person across Nova Scotia asked, what ingredients are in the COVID-19 vaccines? And I know this is a big question. You don't need to go through each individual ingredient, but just a general sense of, what is in this vaccine?
So there's a specific list of ingredients in the vaccines, and it's available at the Health Canada or Canada.ca website. It's not a long list. It's actually fairly simple vaccines. So I would encourage people to go and review those in advance. But maybe what I could mention that might be helpful is what the active ingredient. So in the mRNA vaccines, it's a piece of RNA, and I can explain a little bit how that works. So what that does is when it's injected into your arm, it actually goes not into your cell's nucleus, so it doesn't change your DNA. The RNA just goes in there, and it actually gives your cells instructions on making a protein, which is what we would see if you had COVID-19. So it makes a protein on your cell surface, and then that tells your body to develop the antibodies for it. So if you ever did get COVID-19, you've already got those antibodies there. So that's the main active ingredient in the mRNA vaccines, which is Moderna and Pfizer. In terms of allergic reactions, what we know is that if someone is known to have like a severe allergic reaction to something called polyethylene glycol, that is one of the ingredients that we find in the mRNA vaccines. And as well, there's another ingredient in Moderna called tromethamine, and that is something that could potentially cause allergic reactions. So if you know you have an allergy to those things, those are the things to kind of look out for in the ingredient list. In terms of AstraZeneca, the way that vaccine works, so the main active ingredient is actually a viral vector. And what that vector is, it's a completely inactivated, harmless virus, like a cold virus that we normally would see. But it's inactivated and it's not a live virus. And it does the same thing. It goes into your cells, and it tells your cells how to create a protein again on the surface. And then that protein causes your body to produce antibodies. So again, a harmless virus, it can't cause COVID-19 in your body. And the thing to look out for that in terms of ingredients with AstraZeneca is it contains polysorbate. So if anyone knows that they've had an allergic reaction to polysorbate in the past, that's the thing to look out for in the AstraZeneca vaccine. I think it would be timely as well to mention, given all the information about AstraZeneca recently, right now the National Advisory Committee on Immunization have recommended that it only be used in adults over the age of 55. And in Nova Scotia, we're only using AstraZeneca actually for a small age range of people 55 to 64. There has been a safety signal that's been found, particularly in Europe, with blood clots in people under the age of 55. And that's a reason for a number of countries kind of putting it on hold for people that are under that age group until we really determine, what is the cause. But overall, the risk is still extremely small and rare, and that, the benefits of the vaccine in terms of preventing COVID disease, really outweigh the risks. But while this is under investigation in Canada, AstraZeneca is now only recommended for people over the age of 55. And in Nova Scotia, if you're over the age of 64, you will be getting one of the mRNA vaccines.
Awesome. Yeah, that risk benefit analysis is an important process to go through when you're getting any medical treatment, but that's great to think about when it comes to the AstraZeneca vaccine. Yeah. Thank you for including that. Next question is a tough one for people. Is there a lot of pain associated with getting a COVID-19 vaccine?
Well, the COVID-19 vaccine is similar in the way it's given to like a flu shot. So it goes into your arm, the upper part of your arm, into your muscle. And definitely there's some pain with it, but it's mild, but it may depend on, people's sensitivity. But certainly it's not considered to be, a severely painful injection. And mainly the pain, that will be caused by the vaccine is afterwards, in the first day or two afterwards. That's a lot, several people, like more than 50% that get the vaccine report having that sort of soreness in their upper arm. But it's fairly similar to what you would experience if you got like a flu shot.
Right. Which, many of us have had, vaccines in our life, and we all sort of are familiar with that. Oh, I can't quite lift my arm comfortably today. But, it lasts only a day or so. So again, risk benefit, definitely worth it.
Yeah.
So would it be possible to develop COVID-19 symptoms or contract COVID itself after getting the vaccine?
So because the vaccines don't contain any live virus, it actually is not possible for it to cause COVID-19 symptoms or to develop COVID-19 as a result of it. So if someone did develop symptoms that were like COVID-19 once they've been vaccinated, like, cough or shortness of breath or sore throat, those things actually, it takes a couple of weeks before the vaccine can really kick in and start to provide protection. So yeah, if you did develop any symptoms that were similar to COVID-19, then you still would need to be tested, but it doesn't mean that you got it from the vaccine. It could mean that you were exposed. But
right, exposed before you were vaccinated, yes, or in the interim period while your body was, yes. Okay, that makes sense to me.
Yeah.
Great. And this is our final question that we're asking all of our experts, so feel free to have a little bit of fun with this one. What do you think a post-vaccination Nova Scotia would look like?
Well, I think we're all asking that question.
It is the million-dollar question, yes.
Yeah. I mean, certainly as health experts, we really hope that, if a high percentage of the population is vaccinated, it will create some herd immunity. So that will really help in opening up our province and opening up Nova Scotia. But we have to keep in mind that the vaccination is really, it's one tool in our toolbox that we can use against COVID-19. So for some time, we're still going to have to, abide by the public health measures. Likely, people will have to still wear a mask when they're indoors. There may have to be some physical distancing as well. And it's mainly because we just still need some time to monitor how effective the vaccine is. It's still early days, but certainly, I think we'll be looking at those countries that have the higher vaccination rates and watching really closely what's happening there. And I guess the only other thing is the variants. Like this is a virus similar to like influenza, that it can change quickly. It can kind of continuously evolve, and that's why we're seeing these variants. So we really need to be very conscious of that and cautious at this time before we can just go ahead and just open up freely as much as we want to. So I think we're hopeful. I think we, other provinces are seeing this third wave, and Nova Scotia, we've been really, really lucky because people have been paying attention to the public health measures and our vaccination rates are good. So combined with the vaccine and low rates of disease, we'll see where things go. We may be in a better place than other provinces, but I think I'd have to say, yeah, we'll still have the masking in place and some of these public health measures for some time. And we really want to be careful and watch and see how long actually the vaccine is going to protect us as a person and sort of protect the population at the same time. So I think it's sort of a wait and watch game.
Yes. Stick to the public health measures that we're all comfortable with until we get sort of the green light on that, and we've got community immunity. I think that's a great plan going forward.
Exactly, that's it. We want community immunity.
Amazing.
Yeah,
absolutely. Well, thank you so much, Dr. Carew. It's been a pleasure chatting with you. And yeah, enjoy the beautiful sunshine today.
All right, thank you so much.
Thank you. The topic of pain related to vaccination came up frequently in our survey. So we thought we would have our friends from SCIP, who are experts in pain management, give their top advice on how to manage potential needle pain. Here's Erin with her best tips.
These are great questions about pain associated with injections or vaccinations. My name's Erin Aubrey and I work for Solutions for Kids in Pain, or SKIP, as a knowledge broker. We work to get information like what's being asked here into the hands of patients, families, caregivers, healthcare providers, and even policymakers across Canada to support better pain management experiences. So my answer for you today is that vaccines are actually the most common painful medical procedures, yet that pain is preventable. Did you know that poorly managed needle pain can lead individuals to develop more fearful pain memories over time, which may predict distress at future needle procedures in adulthood and avoidance of medical care? It's interesting to note that different people feel different amounts of hurt from a vaccination, and actually that same vaccination can feel different from time to time. Most people don't find the COVID vaccination much different from the flu shot or other vaccinations. When you're getting an injection like the COVID vaccine, for example, it doesn't have to hurt. There's tons of evidence base, which basically means backed by research, tips and tricks out there that you can use yourself and even share with your family to make sure injections are as painless as possible. So trick number 1 is around positioning. So make sure you're sitting up in a comfortable position. Trick 2, use topical anesthetics or numbing cream. So these could be Emla, Amatop, and Maxilene. So it's recommended you apply these 30 to 60 minutes before vaccine injections. These are available for your purchase at local pharmacies without a prescription. Trick 3 is distraction. So watch something on your phone, take some deep breaths, talk to someone about something else. What are you doing after this? What's for dinner? Where's somewhere you want to visit next? Anything to get your mind off of what is happening currently. Trick 4 is get support from a registered psychologist if you have a severe fear or phobia of needles. And trick 5 is do exactly what you're doing here. Learn some tips and tricks before your vaccine, then make a plan for the day of vaccination. If you can remember some of these tips and tricks, you can make sure that it doesn't have to hurt.
Well, in our survey, we found that older adults in Nova Scotia wanted to know if they could feel confident in getting the COVID-19 vaccine with their specific health concerns. To help answer these important questions, I'd like to welcome our next expert, Dr. Laquesta. Dr. Laquesta, would you like to quickly introduce yourself?
Sure. So my name is Gina Laquesta. I'm an adult allergist and immunologist. I've been practicing in Halifax for almost 20 years now. And it seems like I've been living, breathing vaccine questions for the past several months. So hopefully I'll be able to answer some questions.
Fantastic. Yeah, I feel like that being in the vaccine and immunology field, I can imagine that you've been getting a lot of these questions, but we're so lucky and so grateful to have you today. So I'll just get started. The first question is, are there any health problems or medications that would prevent people from getting the COVID-19 vaccine?
So there's very few true reasons to not get the COVID vaccines. If you read the product monographs, the only true reasons are going to be if you have a known allergy to components of the vaccine or what we call excipients of the vaccine. In the newer ones, the messenger RNA vaccines, which have been around the longest, which is still only a couple of months, the only excipient that's there is something called polyethylene glycol, or we call it PEG for short. True PEG allergy is extremely rare. So when people ask the question, I have no idea if I'm allergic to PEG or not, chances are you are not. I only have 2 or 3 patients tops in my past 20 years of practice. So that's how rare it is. Most patients will already be exposed to PEG in some medications that they might take for constipation, in a lot of their own over-the-counter medications and prescription medications they take. So if you really want to know, have you been exposed to PEG with no issues, you could talk to your pharmacist and say, can you just run down my medications and see if there's anything there? In the AstraZeneca vaccine, there's something called polysorbate 80, and that's even more rare to be allergic to. It's in a lot of injectable medications. It's been in a lot of vaccines that we've had already, but we've already been exposed to. So odds are you're not allergic to those. In terms of other reasons where you might speak to your doctor or have a little bit more question about whether or not the COVID vaccine is right for you, certainly if there are issues with your immune system, so either you have a low immune system because of the medications you take or the conditions that you have, we don't think that the vaccines are unsafe for you, but we wonder how much you will respond to those vaccines. Let me be clear, some response is better than no response. We still want you to have your vaccine, but we want you to be aware about that. If you are acutely sick, if you have a cold, if there's some other health issue that's going on and you're not feeling your best, that's probably not the time for you to be getting the vaccine or any vaccine anyway. It's not available for those under age 16, so maybe not for this audience, but at this point, stay tuned. At this point, it's not there. And certainly if you are currently with a COVID infection, which hopefully there will not be that many of us in Nova Scotia, there will be a waiting time before you should get your first COVID vaccine.
Right, right. All really great tips. And I know some people have got grandkids, so I think the 16, knowing when those people will get vaccines is also crucial information. So our next question, you more or less have answered it. I'm going to say the whole question, but maybe the latter section will be a little bit more relevant now. Are there any allergies that would prevent people from getting the COVID-19 vaccine or cause them to have a stronger reaction to the vaccine?
Okay. And again, this is a great question, which I answer every single day in my clinic. So we talked about the allergic components of the vaccines themselves, but what about the individual who has known allergies? When the vaccines first came out, it hit the media, you know, there were some reactions, maybe they're associated with people having allergies, and somebody made a very big precautionary statement saying, if you have allergies, you can't have the vaccines. We've definitely improved our messaging and our guidance since then because it really didn't make sense. If somebody has a lobster allergy, why can't they get their COVID vaccine? We now know that that's really a big disconnect. And if you have, I'm going to say, a regular food allergy or dust mite allergy or pollen allergy, 30% of the population has what I'm going to call regular allergies. You can go get ahead and get your vaccine, and we really have no concerns that there's going to be any relationship whatsoever. If you've had a serious allergic reaction, which we call anaphylaxis, especially to an injectable medication, then we want to watch you a little closer. You can still get your vaccine, but instead of being monitored for 15 minutes, which everybody gets monitored for 15 minutes, you'll be monitored for 30 minutes instead. And you likely will get a conversation with the vaccinator at the clinic who you can talk about that with. If you're somebody who has had multiple serious reactions to multiple different things, then you probably should talk to your doctor about whether it's worth being seen by an allergist ahead of time. Perhaps you are one of those really rare patients who may have the PEG allergy or polysorbate allergy, and we haven't picked up on you yet. So that's the person who may want to ask a few more questions first. But otherwise, in general, these general allergies don't put you at risk for more severe reactions. I think your second part of your question was, would you have a stronger reaction to the vaccine? And I'm not sure what is meant by that. I would interpret it could mean, is the vaccine going to be more efficacious to you? Meaning, does having allergies give you a stronger immune system and you're going to do better than someone who doesn't have allergies? I don't think we can say that at all. And I also don't think that having allergies will make you have what we call the reactogenicity part of vaccines. People get a sore arm, they feel a bit achy, that's all normal stuff. But I don't think it has any relationship to whether or not you have baseline allergies or not.
Great. Yeah, no, I think that's really reassuring for a lot of people, especially I didn't know 30% of the population has allergies. That's huge. So I don't think we would get community immunity if those folks weren't able to get vaccinated. So it's great to hear. Perfect. Third question is, if I've already had COVID-19, do I still need to get vaccinated?
Yeah, I completely see that process. You know, you might be thinking about, well, I've had chickenpox, I'm not going to get chickenpox again, you know, that type of phenomenon. We cannot say that with COVID infections at this point. What we don't know is if you develop COVID antibodies from your acute infection, we don't know how long those antibodies last, and we don't know what's the protective level, meaning maybe you're protected after that first month and then the levels fall right off, or maybe you're protected for 6 months. We just don't know. The good news is that instead of getting 2 doses of vaccine like most of us will with the vaccines available now, maybe you just get the 1 dose and that's your booster dose. So you can say maybe you're lucky that way, you only get one injection. But at this point, we're not at the point where we can say having experienced a COVID infection is going to be protective enough.
Right. When in doubt, vaccine it out.
Sounds great.
Great.
Yeah.
So moving into sort of more of the rollout of these vaccines, why are people with underlying medical issues or conditions not earlier in the COVID-19 vaccine rollout?
Yes, I get that question a lot in my clinic as well, because I see a lot of patients with severe asthma. I see a lot of patients with underlying immunodeficiencies, and a lot of them have been staying at home, following the rules, feeling isolated, just being fatigued with all these COVID precautions. Know that every country is taking a different approach. Even within Canada, every province is taking a different approach. And in Nova Scotia, we've had the luxury of having low COVID numbers. And I support Dr. Strang and our public health group, where the easiest logistical rollout is going to be by age. And by far, age is the biggest risk factor in terms of severe illness and hospitalizations and death. We think the quickest we can roll it out, the quicker everybody will be protected. It's really hard to quantify risk beyond that, right?
Right.
Is it diabetes, of which has a much higher amount of people versus those with immunodeficiency? There's so many different lung issues to consider. So, I know the government has been lobbied by so many different groups to say, what about me? What about me? And it's understandable. But again, I think had we lived in a different province with higher numbers, we absolutely may have to look at that. I think in Nova Scotia, we're able to kind of do it this way. For that matter, nowadays with the variants and the latest news, essential workers, younger people, they are getting priority in some places, and rightly so. So I think that's the best reason I can give as to why we're not prioritizing based on disease status here in Nova Scotia. I think a lot of it has to do with we have the luxury of doing this age-based rollout logistically as easy as possible because of our low numbers.
Right, getting vaccines into arms as quickly as we possibly can. I can imagine doing those calculations would be incredibly tricky. So that does make sense. I hope it makes sense to our audience as well. So our penultimate question here: should I wait and let other people get a COVID vaccine first to see how it impacts them before I get mine?
Mm-hmm. Yeah, good question. Know that we were all amazed and cheering science as to how quickly these vaccines came to availability. And a lot of that was because a lot of the background work in terms of the mechanisms of these vaccines has been done already. I think it was through being able to skip through a lot of bureaucracy and red tape and collaboration amongst teams and research being done simultaneously instead of one step at a time. That's really what allowed us to get vaccines this quickly. Having said that, Health Canada is so rigorous. It really drives a lot of us physicians crazy when we want to get access to good treatments, but rightly so. They definitely do their homework, and we're assured that these are safe products that are released. Keep in mind, these vaccine studies involved tens of thousands of people over months of follow-up. By now, we have what we call real-world evidence, meaning we're looking at tens of millions of doses that have already been administered across the world. So in terms of any major safety signals, I mean, we are catching it. We are following and monitoring this so closely. So in terms of waiting for other people to see what the impact is, I feel like you can't wait anymore. What are you waiting for hundreds of millions of doses? They are really proven to be safe vaccines.
Right. We've got such a good swath of the population that we already know. I think that's enough information, hopefully, for everyone to feel confident in these vaccines. And our final question, this is one we're asking to all of our experts, so feel free to have some fun with it. What do you think a post-vaccination Nova Scotia looks like?
Oh, goodness.
It's the $1 million question.
It is. I mean, for some of us, the few of us who've already had vaccinations, during this rollout, nothing changes, right?
Mm-hmm.
We still need to mask and distance and no essential travel, all those public health guidelines that we've been practicing for over a year already. It's hard to know when that's going to change. I think it will depend on the number of percentage of population we get vaccinated. I'm encouraged that our American neighbors down to the south, they're much bolder and braver than we are. We're much more conservative, but their CDC has already made some recommendations for those who are fully vaccinated. Canada's far more conservative, and I think rightly so. I think the variant question is still up in the air. Mm-hmm. And certainly at this moment in time on April the 9th, the variant question is quite active. But I really think there is light at the end of the tunnel. We just need to keep going forward and get vaccinated and support each other. And I'm hoping we'll get back to normal soon.
Right. Stay safe as you can until as many people as we can get vaccinated. I think that's great messaging to send out. Well, thank you again so much, Dr. Laquesta, for tackling these questions, and I hope you enjoyed the beautiful sun today.
Yep, thanks.
So when asking older adults across Nova Scotia what their questions were about vaccination against COVID-19, many people in this community wanted to know when and where to get their vaccines. To help answer these important questions, I'd like to welcome our next expert, Dr. Shelley Deeks. Dr. Deeks, would you like to quickly introduce yourself?
Sure, Natalie, and good morning, everybody. My name is Dr. Shelley Deeks, and I am the Public Health Surveillance Medical Officer of Health in the Office of the CMOH in Nova Scotia. And I'm also the Vice Chair of Canada's National Advisory Committee on Immunization, or NACI.
Well, we are super lucky to have you. I know it must be an incredibly busy time for folks around NACI, so we'll launch straight into the questions. So first question is, when can I get my COVID-19 vaccination, and where do different people fit into the schedule?
Okay, so as your listeners may know, COVID-19 vaccines began to be approved by Health Canada in December of last year, December 2020. The vaccination programs across the country are based on what we know about the vaccine supply as it comes into Canada. Specific vaccine requirements that are specific to individual vaccines. For instance, one of the vaccines, Moderna, is only licensed for people 18 years of age and older, whereas the other one, Pfizer, is licensed among people 16 years of age and older. And we also need to consider the need to immunize populations who are at the greatest risk of harm if they get COVID-19, and maintaining the health infrastructure. And then finally, the level of disease in each province and territory. We also know that the likelihood of severe illness and death increases as populations or as people age. And we know that people living in settings where they are in close proximity are also more likely to pass COVID-19 to each other. For example, people living in long-term care homes.
Right.
Yes. Finally, we know that First Nations and African Nova Scotia residents are often disproportionately impacted from COVID-19. So all of those considerations we're taking into account when we were looking at priority groups. So Nova Scotia began our vaccination program immunizing residents, designated caregivers, and healthcare providers who work and live in long-term care settings, and that started in December, as well as healthcare providers in acute care facilities who are most at risk of not only contracting COVID-19, but potentially passing it on. Specialty clinics planned by First Nations and African Nova Scotia communities are being held now. And we've also now moved into the community where people who are 80 years age and older can be immunized at community clinics across the province. This age group will drop in 5-year increments as each group is immunized. And ultimately, all people in Nova Scotia for whom the vaccine is licensed will be able to get immunized.
Fantastic. Very thorough answer there. And that's great because we had some questions about those specific priority groups, such as Indigenous groups here in Nova Scotia. So I'm really thankful that you went over that as well. We'll move on to the next question. How will I be notified when it's my turn to get vaccinated? And is this system of notification going to change from dose 1 to dose 2 if you're getting a 2-dose vaccine?
Yes, so you will be notified when it's your turn through various means. So there'll be press releases. You can be listening to the briefings by the Premier and Dr. Strang, through TV, radio, and various government social media channels. Vaccine clinics are currently open, as I just mentioned, for seniors 80 years of age and older. You can book a vaccine appointment for yourself or your spouse. You can also have a family member or friend call or book online for you. It's easy and safe to book over the phone or online. So you basically have 2 options. You can book online through novascotia.ca /vaccination. You get a booking confirmation by email when you're successful. If you don't receive a booking confirmation, you should check your spam or junk mail folder just to make sure it hasn't gone there. And as I mentioned, you can get someone to help you with your booking online if that's easier for you. You can also book by phone. So there's a 1-833 number. It's 1-833-797-7772. And it's opened from 7 a.m. to 10 p.m. 7 days a week. You'll need a valid Nova Scotia health card to use this service, and you'll need to provide a phone number where you can be contacted. As you mentioned, the COVID vaccines that are currently being used in Nova Scotia are given in 2 doses and 105 days apart. So you don't need to book your second dose appointment. It will automatically be booked for you 105 days after you receive your first dose at the same time and location as your first appointment. So if you book online or provide an email over the phone, you'll receive an email confirmation 1 day before your appointment. The other thing I'd like to mention before you get your vaccine is that you should read the coronavirus vaccine fact sheet, and so that you know what to expect and prepare any questions you have about the vaccine. It's also a good idea if you have any questions about the vaccine to talk to your primary care provider in advance. You can be doing that now about COVID-19 vaccines.
Fabulous. Yeah, it's great to know that that you automatically get registered. I think that's a fantastic way of going about it, and that someone else can book for you, because I know some of folks in our audience may not be comfortable with the technology online and booking online. So it's really great to know that you can book by phone, or if you need to have someone do it for you, then that's an option as well. So I'm glad to hear that. So we're going to move on to our next question. Where will the COVID-19 vaccination clinics be, and how will I get there if I don't have my own transportation?
Yeah, so that's a great question. And I would encourage everyone to keep checking the booking site, the website that I provided often. There's a lot of information there, and it includes a list of community clinics where the vaccines will be delivered. So there's clinics in Sydney, Halifax, Truro, New Minas, Antigonish, Yarmouth, St. Amherst, Bridgewater, and Dartmouth. So all of that information, including the specific locations of the clinics, are on the website. In terms of transportation, in Nova Scotia, there's a great transportation resource called the Community Transport Network. And it is, you can book your transportation online. That's at Nova Scotia Community Transport Network or Community Transport NS.ca. Or you can also call them to book an appointment or to book your transport. That's at 1-833-899-2253. This is an interactive website where you put in your location and the type of transport required. So you need to you can let them know if you need wheelchair accessible transport, shuttle service, or door-to-door. And a list pops up with a list of providers you can contact to arrange cost-effective transit to your vaccine appointment.
Great, yeah.
And I'm happy, Natalie, to provide you the specific information and websites after this so that your viewers will be able to have that.
Great, yes, and we are going to put this information into print as well, so that's very useful for us. I actually hadn't heard of the Community Transport Network before, so that is a very exciting piece of information for myself, so I can spread that around to the folks in my community as well.
Yeah, it's great. We want to make sure that the vaccine is accessible as possible because it's so important that people get vaccinated.
Absolutely, absolutely. Make sure we're getting to all the folks who need it, which is pretty much all of us, which is great. Fantastic. So sort of talking about the vaccination clinics, we'll keep with that theme. Will the clinics be safe when I get there with so many people in line to get vaccinated?
Yeah, that's a great question, Natalie. So vaccine clinics are all following public health measures. So all staff, volunteers, and people being immunized will be wearing masks. As we've just gone through, appointments are pre-booked, and that's to help control the flow of people. And you should be aware that only one support person can accompany you to the clinic. There will be physical distancing by separating people who are waiting both before and after the vaccine, and traffic patterns will be marked on the floor. I think we're all used to seeing those arrows and markings by now.
Oh, yes.
Everybody will complete a self-screening for COVID-19 symptoms, travel, or a close contact of a known COVID-19 case prior to work or coming to enter the clinic. And of course, there's an emphasis on good hygiene, so frequent hand hygiene, avoid touching our faces, respiratory etiquette, and there'll be disinfecting of frequently touched surfaces. So people should feel pretty confident that the vaccine clinics are as safe as they can be. Everybody actually has a role to play in keeping our clinics safe. So you shouldn't come to the clinic if you have any COVID-19 symptoms or have been directed to self-isolate. So that is the role that everybody can assist with keeping everything as safe as we can.
Right, and I hope we're sort of used to these roles by now.
Exactly.
It has been a year. So in the event that someone was feeling unwell and they did go to a clinic, or they didn't go to a clinic, I should say, rightfully so, what would they do in that situation? Would they rebook? Would they have to call someone?
Yeah, that's a great question, Natalie. I know that there's a process for that. Unfortunately, I don't know what it is. So I don't have that answer at my fingertips, but what I'm going to do is follow up and I'll provide you with that answer so you can let everybody know.
Perfect. I really appreciate your honesty there. It's really important to make sure that when we don't know the answer, this is something we talk about at the Discovery Center all the time, because people will ask me questions. They'll be like, wow, that's a great question. Let's find out together. So that's what we're going to do. I think that's a fantastic way of going about it. Great. Dr. Deeks was able to follow up on that question. If people are sick when their appointment is scheduled, they should cancel their appointment online if they made it online, or they can call that toll-free number if they booked it through that number. They would then book another appointment through the same mechanism. It's important to note that this person would remain eligible to receive the vaccine. Great, so we will move on to the next question. What measures are being taken with the vaccine delivery system to make sure that the second dose is given on time? Now, I know the timing has changed a little bit in recent days, so I'll let you speak to that.
Okay, so we are working with our federal, provincial, and territorial colleagues on vaccine supply as well as vaccine allotment. So the federal government has procured enough vaccines for all Canadians. As the vaccine supply increases, all Nova Scotians will have the opportunity to be vaccinated. Initially, vaccine manufacturers required that the vaccine be given at a strict interval. So for Pfizer, the one vaccine, it was used at a 3-week interval, and for Moderna, it was used at a 4-week interval. And we were sticking to the interval that was used by the manufacturers. However, as the vaccine has been used on large populations around the world, we've learned much more about the effectiveness of the vaccines after a single dose and how long that protection lasts. So the second dose is really important because it's required to ensure that the immunity continues and becomes stronger, so a long-lasting immunity. But by delaying the second dose, what we do is we ensure or we enable many more people to be vaccinated and protected against COVID-19 sooner. So, so that's why the decision was made to delay the interval between the second and between the first and the second dose. And there will be adequate vaccine allotted for the second dose at the 4-month time frame. Does that answer your question, Natalie?
Yeah, absolutely. I think it makes sense that, you know, we want as many people to get vaccinated as possible. And because that timeline has grown and that space in between has been verified that it makes sense to sort of pull it apart a little bit longer, that we would be able to get more people onto the first dose, knowing that we have enough vaccine sort of in our coffers, if you will.
Yeah.
Great. We'll move on to our next question here. Is the COVID-19 vaccine mandatory? Do I have to get it?
No. So the COVID-19 is not mandatory. However, the vaccine is a safe and effective way to protect us all from COVID-19. So despite it not being mandatory, I personally am hoping that that everyone feels confident to receive this vaccine. I know I'm going to receive this vaccine. My parents are going to receive it, as are my children. So I'm hoping that everybody embraces this wonderful opportunity to prevent ourselves, to protect ourselves from COVID-19 and get vaccinated.
I can't wait. I'm so excited. I have like my vaccine selfie already. Oh, I can't wait until the day. But you know, I'm in the younger cohort, so it'll be a while for me.
Yeah, I can't wait either.
It's great to hear that confidence, again, coming from an expert like yourself. This one you've already touched on a little bit in your previous answers, but it was a question that came up, so I do want to address it. Are there differences in the COVID-19 vaccine availability and accessibility between rural and urban areas?
So both urban and rural areas will have equitable access to the vaccine. In the beginning, we received a very limited number of doses of the first vaccine that was licensed, so the Pfizer vaccine, which had very strict transportation rules and the requirement for storage at ultra low temperatures. So that meant that our first doses of vaccine had to be given to healthcare providers in Halifax. And at that time, we were actually seeing a higher number of cases in the area and were concerned about community spread in the area. However, as time has gone on, vaccine storage sites have been set up across the province to provide vaccine infrastructure in every zone. So everybody will have access to the vaccine.
Great. And I know with the, I don't believe we have the J&J yet in Nova Scotia. Is that correct?
Yeah, so that product has been licensed by Health Canada, but we don't have any product, any Janssen yet in Canada.
Right. And that would, in the future, when we do get it, it has a lower temperature, so it can just be kept in sort of a normal fridge. So I imagine that would help the process as well.
Yeah, so does AstraZeneca. Both of them are stored in a similar way.
Oh, fantastic. That's great to know.
The difference is that the Janssen product, or J&J, is a single dose, whereas AstraZeneca is a double dose, or is 2 doses.
Absolutely. So now I'm going to move on to the final question. When we received the survey response, I just thought it was a great opportunity to ask it to all of our experts to just get a sense of what people were feeling. So Dr. Deeks, as an expert in this field, what do you think a post-vaccination Nova Scotia would look like?
Well, that is the million-dollar question.
It sure is.
So, you know, that's a great question. We are still learning about this. As more and more Nova Scotians are vaccinated, what we are predicting is that the burden of disease will reduce both here and elsewhere in the country. We have stayed safe by restricting the number of people we gather with, following public health measures such as physical distancing, wearing masks, practicing sneeze and cough hygiene, of course, washing our hands frequently. And these are good health practices to follow, and we're going to keep on having to follow them for a while. It will take some time before the measures can be reduced, and public health will make the decision to ease restrictions depending on the burden of disease, both within our province as well as outside of Nova Scotia, and seeing what's happening in the rest of the country. We definitely don't want to move too quickly, only to have to bring back restrictions. I know we are all tired of restrictions, and so we're very aware of the need to keep on top of the evidence. What we're unsure about now is if people who get the disease after vaccination can still transmit the virus. Now, there's preliminary studies that are showing really promising results, that the vaccine actually decreases our ability to get to have asymptomatic infection. We're expecting to know more about this really soon. And once we have that information, we will be able to start adjusting public health measures among those that have been vaccinated.
Great, yeah, so making sure that transmission, hopefully, fingers crossed, that if someone does have the vaccine and does end up getting COVID, that they can't pass it along, or it's a really low chance of them passing along. Is that a good way of sort of summarizing that?
Yeah, that's exactly right.
Great. Well, I know we can't wait for post-vaccination Nova Scotia. And I just want to thank you again, Dr. Deeks, for helping expertly answer these questions about vaccine distribution in Nova Scotia. It's much appreciated.
Okay, thanks, Natalie, for having me. And I'm happy to answer more questions if you or the group have any more.
Thanks again to those who joined us virtually and to our amazing experts. If you'd like a print copy of some of the top tips from this video, please print the brochure below. Thank you so much and stay safe out there.